Good evening, guys. I have discussion C for you. We're discussing the article 6 Things Many People Get All Wrong About Long-Term Care. Okay, so I'm going to go through the whole presentation for you. Hope this helps some people that are getting ready to go through this with family members and such. So please enjoy. Here's a concise summary of the takeaways from the article 6 Things Many People Get All Wrong About Long-Term Care. Okay, common misconceptions about long-term care. The article highlights widespread misunderstandings that leave many Americans unprepared for the financial, emotional, and logistical realities of aging and caregiving. Understanding costs. Too many people don't realize how expensive long-term care can be, especially when it involves assisted living, nursing homes, or in-home supports. Assuming Medicare covers it all. A common myth is that Medicare will pay for long-term care, but it typically only covers short-term rehabilitation, not ongoing custodial care. Okay, folks, there's a difference. Short-term means a 30-day stay for therapies, for physical therapy, occupational therapy, or getting somebody adjusted to what it's going to be like. So okay, then we've got delaying planning. People often wait too long to plan, assuming they won't need care until much later. This delay can limit options and increase stress for families. Overlooking emotional impact. The strain on caregivers and families is often underestimated. Emotional burnout and family conflict can arise without proper support systems. Ignoring insurance options. Many skip exploring long-term care insurance or hybrid policies, which could help offset future costs if purchased early. Failing to communicate. Families often avoid discussing care preferences and financial plans, leading to confusion and crisis-driven discussions. The article draws from a nationwide Retirement Institute survey, emphasizing the need for proactive, informed planning. If you'd like, I can help translate these insights into culturally responsive planning guide or myth-busting resource tailored to your community work. Long-term care planning is a multi-dimensional challenge. financial, emotional, cultural, and logistical. Here's a structured, actionable framework that aligns with your systems level thinking and participatory approach. Fundamental steps for long-term care planning. Assess current and future needs. Evaluate physical, cognitive, and emotional and social health. Use culturally adapted ADL checklists and community informed assessments. Include trauma informed and intergenerational considerations for marginalized populations. Engage in family and community dialogue. Facilitate open conversations about care, preferences, autonomy, and values. Use life review prompts and storytelling to surface culturally rooted expectations. Co-design care plans with elders, caregivers, and trusted community members. Explore care options. Compare in-home care, adult day services, and assisted living, and skilled nursing. Map local infrastructure gaps, especially in rural areas and underserved areas. Consider culturally responsive models like multi-generational housing or community-based respite care. Plan financially. Understand what Medicare and Medicaid and private insurance do and don't cover. Explore long-term care insurance, hybrid life policies, and state-specific programs. Use budgeting tools to project costs and identify funding gaps. Document legal and medical preferences. Establish advanced directives, power of attorneys, and HIPAA authorizations. Ensure documents reflect cultural, spiritual, and familiar values. Store and share summaries with trusted agents and care teams. 6. Build a support network. Identify formal and informal caregivers, including community health workers. Use participatory mapping to visualize roles, gaps, and burnout risks. Integrate caregiver training, peer support, and culturally adapted toolkits. Monitor and adapt. Regularly review care plans, finances, financials, and emotional well-being. Use feedback loops and evaluation matrix to measure effectiveness. Adjust for change. Adjust for changing needs, preferences, and community resources. Would you like to co-create a customizable planning guide or toolkit that integrates these steps with your myth busting and outreach work? I can help you build something modular and culturally grounded. Adapting long-term care planning for diverse cultural contexts means honoring values, traditions, and lived experiences while still addressing practical needs. Here's a participatory framework tailored to your work that bridges clinical rigor with culturally humanity. Culturally adaptive long-term care planning for framework. Start with cultural listening. Conduct community dialogues, story circles, or oral histories to surface beliefs about aging, caregiving, autonomy, and death. Use participatory ethnographs tools to identify culturally rooted expectations, e.g., fatal uh, pay, pity, spiritual caregiving, collective decision making. Co-design with community stockholders. Involve elders, caregivers, faith leaders, and culturally brokers in shaping care plans. Use visuals. Use visual mapping, translated materials, and culturally resonant uh, metaphors to facilitate engagement. Adapt life review prompts to reflect ancestral wisdom, mitigation, stories, or spiritual milestones. Customize care models. Modify care settings to reflect cultural preferences, e.g., gender, congruence, caregivers, community, communal meals, spiritual rituals. Explore alternatives like co-housing, intergenerational compounds, or culturally specific adult day programs. Integrate traditional healing practices alongside clinical care when appropriate. Translate financial planning into actionable, accessible formats. Use culturally relevant examples and uh, analog analogs to explain insurance, Medicaid, and saving strategies. Partner with trusted financial educators or community organizations to host multilingual workshops. Address historical mistrust and systematic barriers. Transparency. Build culturally responsive support networks. Train caregivers in cultural humanity and trauma-informed care. Create peer support groups that reflect shared identity, e.g., LGBTQ elders, rural African American caregivers. Offer respite and mental health services that honor cultural expressions of grief, stress, or resilience. Evaluate and integrate with cultural matrix. Use mixed methods, evaluations that include storytelling, community feedback, and culturally adapted scales. Track outcomes like trusted satisfaction and perceived dignity, not just clinical matrix. Share findings in community forums to foster transparency and co-learning. Would you like to co-create a modular toolkit that embeds these adaptations into your existing outreach and caregiver resources? I can help you build templates, prompts, and evaluation matrix tailored to specific populations. Long-term planning, long-term care planning is essential, but it's rarely straightforward. Here's a breakdown of the most common challenges, especially relevant to your work, where cultural responsiveness, infrastructure gaps, and caregiver equality are front and center. Common challenges in long-term care planning: financial complexity and misinformation. Many assume Medicare covers long-term care. It doesn't. Beyond short-term rehab, Medicaid eligibility is confusing and often misunderstood, especially for middle income families. Long-term care insurance is underutilized due to cost, lack of awareness, and mistrust. Workforce shortages and burnout. High turnover rates among RNs, LPNs, and CNAs, up to 78% in some roles. Staffing shortages lead to unmet needs, lowering care quality and caregiver distress. Culturally mismatched between caregivers and recipients can exacerbate emotional strain. Infrastructure and access gaps. Rural areas face limited facility options, transportation barriers, and fewer trained providers. Facilities often lack culturally adapted services or multilingual staff. Home based care is underfunded and inconsistently regulated. High acuity patients in lower resource settings. Hospitals discharge patients earlier, pushing complex care needs into long-term care settings. Facilities struggle to manage chronic conditions, cognitive decline, and behavioral health without adequate support. Emotional and family strain. Families often delay planning, leading to crisis driven decisions. Lack of communication about preferences and finances causes conflict and confusion. Caregiver stress and isolation are common, especially in communities with limited support networks, policy, and systematic barriers. Heavy reliance on Medicaid and Medicare limits innovation and personalization. Regulatory burdens can stifle culturally responsive models and community based solutions. Public financing creates moral hazards and discouraging early planning and private investments. If you're building toolkits or outreach materials, I can help you design myth busting modules, caregiver support maps, or culturally adapted planning guides that address these challenges head on. Want to co create a matrix that links each challenge to actionable solutions. Okay, guys, so that is it for tonight. I will see everybody for shows Monday. For now, Gator Wellness. Take care, folks. Have a good weekend, please.